Hey beautiful people, welcome to my channel. In today's video we are going to be talking about nasopharyngeal sunctioning. Somebody sent me a mail 2 days ago and she said to me, Nurse V, I had nasopharyngeal sunctioning. I was so destabilized, my catheter fell to the ground and I'm just so confused. I'm so destabilized. Now guys, in today's video, not just her, 2 or 3 other people sent me a mail complaining about having issues with nasopharyngeal sunctioning. And so in today's video I want to tell you errors to avoid when you do nasopharyngeal sunctioning. It is very important, so I would encourage you to watch this video to the end. Before we dive into this video, I'd like to give a shout out to those of you who passed your OSCE exam. Just yesterday alone, I got 8 emails. I can't remember all of them who sent me emails, but I know Millicent. I'm super proud of you, Millicent. Welcome to your band 5 rows. I'm super proud of you, Sarah. Welcome to your band 5 rows. I'm super proud of you, Constance. Welcome to your band 5 rows. I can't remember again. I'm super proud of you, Beauty. Welcome to your band 5 rows. And I'm super proud of you all. I can't remember all that names, but if you passed your OSCE exam, those of you sent me emails yesterday, I'm super proud of you all. Like, more than the sky is your limit. And if you are planning to take your OSCE exam soon, guess what, guys? OSCE is simple, nurses are brilliant. I can't wait to congratulate you because I'm very 100% positive that you are passing that OSCE exam and you are smashing that OSCE exam. So practice with your friends, practice with your peers, and don't forget to watch videos with marking criteria. Now, if you are seeing my face for the very first time, my name is Violet Okalacha. I'm a registered nurse. I live and I practice in the UK, and on this channel I've had thousands of nurses pass their OSCE exam in one sitting. So share this video with everybody who you know is preparing for OSCE exam. Don't forget to like, don't forget to share, and don't forget to subscribe. Let's get to the topic for today.
Ryan Little.
Alright guys, we are going to talk about errors to avoid so that you can pass your OSCE exam if you have nasopharyngeal sunctioning. Like the scenario I gave you, if for any reason at all your catheter falls to the ground, remember, nasopharyngeal sunctioning in your OSCE exam is not a sterile procedure. It is a clean procedure. And if your catheter falls to the ground, all you needed to do, or all you would need to do, somebody will say, Nurse Violet, why should somebody catheter fall to the ground? It could be anxiety. It could be pressure. You know, when you're writing an exam, you could be anxious, and mistakes you are not supposed to make, you go ahead and make them. So if it happens, please, like I told the lady, you shouldn't be anxious. If it happens, your catheter falls to the ground. Oh, I say so. My catheter has fallen to the ground. In a re-exam setting, I'll pick up this catheter, discard it in the clinical waste alongside with my non-sterile glove, do my hand hygiene, get another catheter, put on another glove, and go over the procedure. Do you want me to do that, assessor? And whatever she tells you, do. If she says yes, go ahead and do that. Or if she says assume it's been done, then you change your glove and you continue. So just do as your assessor says, but make sure you verbalize it, okay? Now let's look at errors to avoid if you are having nasopharyngeal sunctioning, so that we can pass this skill in OSCE exam. Now this skill is 8 minutes. If you see me looking down, it's probably I'm looking at what I've jotted down. All right, so the first and the most important point is you must maintain or arrange a signal with the patient. You know, for nasopharyngeal sunctioning, you have to tell the patient, if you want me to stop, please raise your hand. So the first point is you must maintain signal with the patient. That is very, very important. Okay, now the second point you must maintain is you must verbalize that you are going to monitor the patient's condition throughout. What are you monitoring? The patient's color, the patient's respiratory rate, the patient's heart rate, any cough or any trauma at all. So you must monitor, or any secretions. You must monitor all these in response to the what? To the pre-suction baseline observations or guidelines. Okay, that's number 2. So tick. And number 3, you must make sure the patient is in a semi-upright position with the head supported with pillows. So tick. And number 4, you must make sure you put on all your gadgets. All your gadgets, your glove, your apron, your goggle, you must make sure you put on all your gadgets. Another thing is you must validate all your equipment. What do I mean by that? In some centers it is a trolley procedure, and in some centers it is a tray procedure. So if it is a trolley procedure or a tray procedure, and probably they've set everything up for you in your trolley, or they've set everything up in your tray, make sure you validate your equipment. This is my suction catheter accessor. This is size 10 or this is size 12. The expiry date is, this is my gauze, the expiry. So you must validate. Failure to validate your equipment can result in what? Can result in causing harm to the patient, because you may end up using expired equipment. Do you understand? So that's very important. Another thing you must do, you must make sure the patient nostrils are patent. If you fail any of these, or if you forget to say any of these points, you may end up resitting your OSCE exam. So make sure that the patient's nostrils are patent. How do you do that? Can you sniff your right nostrils for me? Can you sniff your left nostrils for me? Then you are sure that the patient nostrils are patent. Now you must be sure that you are using the right size of catheter, and the right size of catheter to use is size 10, or you use size 12. Now you must make sure, tick. Now number 5th or number 6th point is just make sure you set the suction machine at 12 to 20 kPa, or at 100 to 150 mmHg, and verbalize that your suction machine is working. Tick. Then you attach your catheter to the suction tubing. You have to verbalize it. You have to do it. You're doing and you're verbalizing it, okay? Tick. Then the next thing, you must lubricate the tip of your catheter with sterile water. After lubricating the tip of your catheter with sterile water, then you go ahead and apply gently, or put gently into the patient nostrils, and tell the patient to inhale while you pass the catheter into their nostrils, okay? Then verbalize to the patient that you are going to stop if you meet a resistance, or if the patient cough. So once you meet a resistance or the patient cough, withdraw the catheter 1 centimeter before applying the suction. Tick. Then make sure you verbalize to the patient that you are going to be giving intermittent suction at 10 seconds interval. And this is why a lot of people fail. They go ahead and suction patient for 1 minute, verbalize, and that you are giving intermittent suction, and you are giving it 10 seconds apart, and that you are only allowed to give what? 2 to 3 suction. So once you suction the patient's lungs, ask the patient, do you want me to suction you the second time? If the patient says no, lubricate the suction tubing with what? With sterile water. Make sure you clean the patient's face, make the patient comfortable, and verbalize that you will continue to monitor the patient condition, e.g. color and the rest of them, respiratory rates, any trauma, and make sure you dispose all your equipment in the clinical waste. Do your hand hygiene, and that is the end, guys. And that is the end. So make sure you verbalize while you are doing it that you'll be rotating the catheter while suctioning, so that you don't damage any of the underlying structures, okay? And that is the end. That is a very big pass in your OSCE exam. So guys, I can't wait to congratulate you. This video is a guide to help you pass nasopharyngeal suctioning, okay? So do it to like, do it to share, don't forget to subscribe. If you have any videos you want me to work on, comment in the comment section and I'll definitely work on it. If you are writing soon, my prayers are with you. You will definitely succeed, and I can't wait to congratulate you. Thank you so much, guys, for watching. I love you all. I will see you in another video. Until I see you again, keep passing your OSCE exam. I love you all, and bye.